Good afternoon, everyone. I will call our meeting of the Committee of the Whole to order. Sheila, can you do a roll call, please?
Present.
Dr. Giles.
Well,
Pastor Jones here.
Pastor Jones is definitely.
Dr. Guadalupe. Here. Ms. Woodruff. Here. Dr. Hans. Ms. Newman. Here. Ms. Root. Ms. May. Mr. Smith. Here. Sorry. Mr. Cowan.
Present.
And Mr. Young.
Here.
Hold on. So I have a quorum of both committees right now.
Oh, good.
So
Okay, thank you. All right, the first opportunity for public comment. Can you check, is there anyone online wishing to comment?
If you are online and wish to speak for public comment, please raise your hand at this time.
Okay, there'll be another opportunity at the end. Anyone in the room wishing to make a public comment? Okay, we'll close public comment. There'll be another opportunity at the end. So can I get a motion to approve the agenda?
Support.
All in favor by aye? Aye.
Aye.
All right. Item 2, the Finance Committee report. We are going to start with the fiscal 24 audit report. Richard and the auditors, why don't you guys come on up, and if we need an extra chair, which we do. No? Just two?
Good evening. We have with us today Jason Kelly from the BDO auditing firm. They have been working with us for a few years now on our financial statement audits, our single audits, and our compliance exam audit. I'm going to let him do a much better introduction of himself, but he is here to present to the committee the results of the audit for 2024, and then I would be happy to also answer any questions related to the actual ending operational results that are contained within the audit result as well.
Thanks, Rich. Good evening, everybody. Glad to be here tonight. Jason Kelly, Senior Manager with BDO. I've been working with OCHN and the independent audit for the past several years, so thanks for having me. If we can move on. Today, we'll go over some financial results from the 2024 audit, which includes the single audit, the compliance exam, and then any questions that the committee may have at the end, we'll be happy to answer. Go ahead. So some financial highlights here. Fiscal year 24, OCHN ended with $25.9 million of total net position. That was a decrease of approximately $24.2 million from the end of fiscal year 2023. We'll get into some of the drivers of that change in some subsequent slides here. And then at the end of the year, OCHN did have $4.4 million of long-term debt payable for residential housing and then administrative housing or buildings, and $1.06 million of debt was repaid during fiscal year 2024. We can move on to the next slide, please. So here we have a summary statement of net position, kind of shows the comparative statement of net position from 24 to 23. As you can see, total assets ended up at $101.78 million at the end of 24. That was a slight decrease, about $25 million from 2023. And the biggest was up in the current and other assets, where the amount due from providers was greatly reduced throughout the 2 years, so that dropped the total assets. Total liabilities remain fairly consistent, $72.6 million compared to $72.4 million. And then again, the net position of ending at $25.9 million, as I mentioned earlier. And then that's broken into three classes. So $16 million is the net investment in capital assets, so the authority's capital assets less outstanding debt on those assets. $12.1 million is restricted, and that left a deficit unrestricted balance of $2.3 million. We can go ahead and move on. So the summary changes in net position next year. This shows how we ended up at that $24.2 million decrease in net position over fiscal year 2024. And as you can see, the operating revenues were actually up $22.8 million. However, operating expenses also grew, and the expenses grew at a rate higher than the revenue coming in. So expenses increased approximately $37 million from 2023 to 2024. So that net difference of approximately $14 million is the difference in the change in net position line from $10.9 million decrease in 23, and that was increased to $24.2 million in fiscal year 2024. Then we can move on. Next slide, please. So this just shows the breakdown of the authority's capital assets. A couple things to note. There was no capital asset additions during fiscal year 2024, so that decrease of about $2 million in the total net balance is the current year depreciation expense. And then move on, next slide, please. This shows the breakout of the long-term debt, long-term obligations. So there's the lease payable for the mental health services buildings of $4.3 million. And then there was $100,000 left on the residential buildings debt at the end of fiscal year 2024. We can move on to the next slide. So we also did perform the single audit and the compliance examination. I'm pleased to report that we are going to issue unmodified opinions on the financial statements, so clean opinions on the authority's financial statements. On the single audit report, we're going to also issue unmodified opinions on the compliance of the major programs that we looked at this year. So we had 3 major programs that we audited under the single audit. There will be one finding that we're going to report in the single audit this year, and that's related to not meeting the 9-month deadline to submit the single audit to the Federal Audit Clearinghouse. So when we report findings, there are 3 levels of findings. You have material weakness, which is the most severe, and then you have significant deficiency, which is the lowest level that as auditors we're required to report to the board in the report. And then there's also control deficiencies, which would be deficiencies that we may identify that we are not required to report in writing to the board, but we would report to management if we had any of those. So we will have the one finding, significant deficiency. It's going to land at related to not timely filing the data collection form with the Federal Audit Clearinghouse. And then the compliance examination, we're also going to issue unmodified or clean opinions on the compliance examination. There was a couple adjustments that will be examination adjustments that will be reported in there, and that was due in relation to the cleanup of some of the due to provider amounts that management worked on cleaning up at the end of fiscal year 24. And with that, that's all that I had today, so we can open it up for any questions or if Rich has any further comments.
Just a couple of highlights also, not, again, as Jason mentioned, right, kind of the highlights of the audit and the fact that we did get clean or unmodified opinions on each of the 3, the financial statements, the single audit, and the compliance exam, which is good news. I do want to talk a little bit to the why we are seeing some of the things that we're seeing. So again, in terms of the $24 million reduction in net position. I just want to talk about that we did take a very conservative approach to the due to, due from providers from our perspective. Some of those balances do relate to fiscal years prior to 2024. So there were some balances out there from 2023 and 2022. And we did book an allowance for receivable for some of those, again, to make sure that we are both conservative in what we're reflecting in the balance sheet and hopefully reasonably stated. So we may find during the collection process that we may actually get a little bit better results than the amount that we reserved. So I did want to mention that. Also wanted to mention that the restriction on the balance sheet of $12 million that is related to our substance use disorder services, our PA2 funding that we receive, so we are required to restrict that. And so if you do think of it, though, that is liquid cash, it's not causing a cash flow issue. So even though we do have a $2.3 million, what we're showing is an unrestricted deficit, that is not a concern from a cash flow statement, cash flow perspective at this point in time. That being said, we are actively looking at how we're going to address that, and we expect that we will not have that unrestricted deficit at the end of 2025. So we're looking to try to correct that by the end of 2025. The final thing that I wanted to mention as it relates to the finding on the single audit, it is a single audit finding, meaning it is a federal compliance issue that we did not file by June 30, 2025 for our September 30. Unfortunately, we can't file that report unless we have the financial statement audit completed. And as was mentioned, there was still some work being done on the due to, due from providers. So even though those balances have nothing to do with the single audit, and even though otherwise the single audit was a very clean opinion with no other findings, it is a required finding that we were late on that. And again, we're looking to finalize that actually this week. So we will be done about 2 weeks after the deadline. We have put in place, we have identified from a root cause perspective what was causing our due to, due from provider issues and some of the delays. And we have a plan in place that not only will that not be happening in June of 2026, we anticipate we'll have that done before Thanksgiving of 2025. Especially with our move to fee-for-service, I have no concerns that this will be a repeat finding next year. So just some additional context related to the reports as presented. And again, if there are any questions, either from an audit perspective or from a results perspective, happy to take that from the committee.
Okay, so I'll open it up first. Sarah, go ahead.
Just in regards to the single audit report, what implications can occur due to that being filed late?
Yeah, so if we were to, and again, the federal government can take a look at that and say, and could come back and say, hey, we expect a more significant corrective action plan related to that. In my experience, unless it becomes a repeat finding, I do not anticipate any actual negative implications to the organization. So we plan to correct this before it would ever become a repeat finding, so I do not anticipate any.
And then you had mentioned the root cause had to do with information that we didn't have. Was that something outside of OCHN or within the agency?
The root cause, just to clarify, the root cause had to do with something that was not related to the single audit, but it was related to the financial statement audit. And unfortunately, you have to file them together, so that's what was holding up our single audit. It has to do with our due to, due from providers, and we go through a fairly extensive cost settlement process with our providers at the end of every fiscal year. And as we were looking to validate or verify some of those balances, unfortunately, we did not have all those validated in time for the June 30. But we've identified, when I say we've identified the root cause, we've identified steps in the process that can be improved to make sure that that will be done more timely going forward.
Thank you.
Any other questions from Finance Committee? Any questions from Policy? Oh, I knew it. Go ahead, Chris.
Can you talk to me as if I'm an eighth grader as far as what the due from and to is?
Absolutely. So by the way that some of our current contracts, not all contracts, but some of our current contracts with our providers allow for us to wait until after the end of the fiscal year to obtain financial data from the providers. This is primarily our core, what we would call our core providers, financial information, and then we may owe them some additional money versus what we've paid them throughout the year, or they may owe us some of that money back. And we call that, in general, we call that our cost settlement process. So that cost settlement process where we true up from the cash paid to the contractual obligation is that due to if we owe them more money, or due from if they owe us some of that money back. And so that's the due to, due from process that we're speaking of.
And fee-for-service changes that at all?
Yes. So the fact that we're moving to a fee-for-service, or have moved to a fee-for-service process for almost all contracts as of July 1st, will eliminate that cost settlement process needing to happen so late. So right now we do have a plan that for those contracts where the cost settlement will be for services through June 30, our hope is to have final FSRs, final financial status reports from the providers by the middle of August, and then we will have all of this calculated and hopefully agreed to with the providers by Thanksgiving. So that process can happen much more timely now that fee-for-service is kind of taken over. And then once fee-for-service is fully implemented, we do not anticipate a cost settlement process will be necessary for most contracts.
Any other questions from policy? No, yeah, go ahead. That's right, you're no committee.
Yeah, I'm the man without a home. Well, first, I'm very pleased to once again hear that we have clean audits. That's something that this organization points to in terms of our taking care of public funds, and that we're very transparent. We share this audit publicly, as we're required to do. But more importantly, it's in the day-to-day operations. That's why you get a clean audit. It's not something that they come and just stamp, oh, you're fine. I mean, they go back and look. You go back and look at a number of different transactions as a kind of a test model, and I think that's a tribute not only to our finance department, but to all the folks who work for us, that we we take seriously, and this board, we take seriously the fact that we're an entity that's almost totally funded by public money. And as a result, I'm very pleased that we had that result. It sounds to me, Richard, like we're kind of a couple weeks late on filing a form.
Yep, we will be. We're in the process of finalizing, I expect, tomorrow or this week.
So of all the things that could happen that we get, a finding on, that's the one that bothers me the least, because I know what a challenge it's been this year. And with you coming on board and getting a hold of the reins, it's understandable that we're going to have a couple weeks delay. So that wasn't done because we were missing something, or there was some gigantic problem that we were trying to resolve. It was simply just a timing issue, and as a result, I'm very pleased with that. And just Chris, just a little background. So as you've learned in a short period of time, we've all learned it's a very complex accounting. But one thing that was identified a couple years ago, we had to get away from this cost settlement thing. It's just not a good way to do business. There was a time when it wasn't as complex, but it is now. So the Finance Committee, the board, working with Dana, came up with a plan, and it's not as simple. They had to go out and get all the ranges for the costs that we were going to allow to be charged. So it was and I know that took a lot of time, and it was all done behind the scenes. So a lot of thought and time and effort was put into the fee-for-service model that we're now going to lay out. But as Richard's mentioned, by and large, this settlement or true up, so to speak, at the end of the year with providers should not be necessary. They submit a bill, it's approved, or some of it's thrown out, they're paid, boom, that's it. We move on. So that's how it's going to work. Now in the past there were these massive bills that came in, usually not in a timely manner. Then we had to sort through it, and then there was all this back and forth, and that opens up the possibility of some things slipping through the cracks, and we don't want to have that happen anymore. So this was part of a plan that goes back a couple of years, we started talking about this. And I'm glad now we're finally able to implement it, and we won't have this problem at the end of every year, especially for our auditors and for our finance team. So thank you very much for all your efforts. Once again, we appreciate it.
Thank you.
So one last question. On the timing of kind of the true-ups in the collection process, ballpark, as I heard you say, we've got things from a couple fiscal years ago.
Mhm.
So this is, everybody's complicated, I think, as we assumed. So kind of give the board a ballpark on how much time it's going to take to
get caught up, so to speak.
Yeah.
Yep.
Yeah, so
So
to speak.
again, so the balances that are in the financial statements are very conservative. We are in the process right now of reaching out to providers that have outstanding balances, either due from us or due to us. The hope is that for all balances related to fiscal year 2024 and prior, right, that we will try to resolve those before September 30 of 2025. So I'd like to have, the cash from those resolved by the end of this fiscal year. Again,
Okay.
it may go a little bit past 10/1,
Okay.
but the target is 9/30.
Okay.
And then any 2025 settlements, as I mentioned before, will be calculated in the August and September timeframe, and we're hoping to have those resolved by around Thanksgiving. So we will have some balances from 2025 at the end, but I hope it's just that fiscal year if at all possible.
Okay, good. One last question, maybe more for Jason. On the capital assets, really the changes are all depreciation related
Correct, yeah, there was
Okay.
no capital additions
or
in
subtractions?
subtractions in fiscal '24.
Okay.
Yep.
All right, thank you. Sheila, do we need, yes, we need a motion from the finance committee.
Support.
All right, we need a roll call to move it to the full board for next week.
Mr. Furman?
Yes.
Pastor Jones?
Yes.
Dr. Guadalupe?
Yes.
Mr. Young?
Yes.
Motion carries.
All right. See this at the full board meeting next week. Thank you both.
Thank you.
And then, Richard, you're still up with the financial update for May 2025.
Yes, so we have the financial update for May of 2025. Next slide, please. We start with our trends. We're going to look at revenue. So through the month of May, again, our revenue trend continues to be fairly flat. You'll see we are slightly above where we were in 2024, that blue line, 2024. You'll notice again that in 2024 we had a little bit of an increase towards the end of the year. And if that increase were not to happen again, we would have ended this year with around the same, maybe slightly less revenue than last year, even though our costs have gone up. I'm pleased to say that MDHHS has indicated that we will get a rate adjustment for 2025. They have indicated they expect that to be about $161 million statewide, so that's not the OCHN portion, but statewide. They've also now given us a timeline, so we expect that they will start making those payments at the end of this month and in the beginning of August. So we have some that I'm expecting this week, this Thursday. We'll get our first set of payments, and then they will come kind of weekly over the next 3 to 4 weeks. Just as a reminder for the Finance Committee, as MDHHS has done in the past, they would just dump a whole bunch of money into a single month, and so we'd see these spikes or these kind of peaks in our trend data. What they're going to do this time is a little different. They're going to actually, on paper, they're going to take all of the payments back and they're going to repay them all month by month. So October of 24, take all the money and pay it back. Now again, on paper, so they're not taking money out of our bank account, but they are going to show that. So when you see these trends in the future, all of these bars are going to just kind of jump up as they make these additional payments. So again, not exactly sure on the amount that is going to be coming to OCHN related to that $161 million. Hopefully we'll be able to calculate that around this time next month, or if not by this time next month, sometime in September. So we'll be able to actually provide that information to the committee.
Is it proportional, or how, do they have a formula, or how do they ballpark?
Yeah, so MDHHS has indicated that their actuaries have a formula that they've applied to that. They are not being as maybe not transparent. They have not shared the formula with us at this point in time. So unfortunately, in the past, I used to be able to say, well, we're approximately this percentage of the state, so I would expect we would get about this percentage. I'm less comfortable doing that at this point because that formula may or may not follow our current formula. So we have not seen that for sure. But we do expect we do know that it will be a positive increase to our revenue. We're just not sure how much of a positive. If we could go to the next slide, please. Again, looking at eligibles, so even though our revenue is staying relatively flat, we do have some eligibility that, and it's kind of hard to see with the blue line, but it is continuing to dip ever so slightly. So we are keeping our eye on that. We continue to talk to the department about the issues we're seeing in the Plan First and or the individuals that are falling off of Healthy Michigan and or Medicaid and not being eligible for that population anymore. The department continues to indicate that they are aware of some of those issues, but we've not heard a concrete action plan on their part of how they plan to address it. They continue to kind of go back to, well, as we set rates, it should correct itself. Unfortunately, it's not very descriptive on what, if any, impact that would have on the revenue side, and it does not in any way address the individuals that really need that Medicaid coverage for the services that they're receiving. So we continue to advocate for more action on the department's end on those individuals that are not becoming eligible or not regaining their eligibility as timely as we would hope. Next slide, please. So for our cash and investments, we are showing that cash is up as it relates to the end of 2024, while receivables are down. So we have started getting some of our cash payments related to prior fiscal years, especially like the CCBHC settlement did come through from MDHHS. So that's good from a cash flow perspective. Next slide, please. In terms of liabilities, really no major change between the two. Again, we expect our vendor payables to be similar to what they ended last year as it relates to the time frame of when we're paying. We may see that liability change a little bit as we move to fee-for-service. So just as a reminder, as we move more and more to fee-for-service, we're going to be less on a prepay basis, right? Under the service models, we were prepaying those service models. In a fee-for-service world, we wait until we get the claim or we get the bill, and then we pay. So we might see an increase in the vendor payables as we start getting into July and August financial statements. So just something to be watching for as we move forward. Next slide, please. Net position, again, we expect a little bit of a decrease, and I'll get into the why that is, but we are projecting that we will have a little bit of a decrease in net position of a couple of million this year. Next slide, please. Next, we'll look at revenue. Again, we do anticipate that revenue will be greater than in the Medicaid. We will have more revenue in 2025 as projected compared to 2024. And so that's good. However, as you'll see on the next slide, we also project that our expenses primarily to our providers will be up over last year. So the revenue that we're getting in the door is going out the door to additional services, whether that's new people we're serving or additional demand from the current population. Next slide, please. So kind of the culmination of that is, at least through the month of May, we're showing a net deficit, meaning our revenues are not quite enough to cover our expenses by about $2.5 million. Again, there are things that we're looking at in terms of cost containment as needed. Again, we're trying to avoid, to the extent possible, touching services, but we are looking at funding sources or what we call fund source management that it's going to be much more targeted. So for example, because we have a different pot of money for non-Medicaid people, we are trying to look at how do we manage the services that those individuals that are not Medicaid eligible will receive. So we are trying to, again, be intentional by funding source and so we can, again, maintain the financial stability going forward. Those are the big highlights from the May financial results, but if there are questions from the committee, I'd be happy to try to address those at this time.
Okay. So, if I could, you just mentioned that this year we're at about a $2.4 million deficit through 8 months. Okay.
Yes.
Last year at this time, we're at 12.8 million. So that's at least according to the slide. I got.
Yep.
So that's pretty significant improvement over where we were last year, because and that's because of some measures we took here. And part of that is that we couldn't take another hit like we did last year with a net change in position of $24 million. So then the point that I forgot to make when we were talking about the audit is that those monies that were basically taken out of our savings, so to speak, if you want to put it in the eighth grade, the eighth grade level, what I used to call the fund balance in municipal accounting, and is that went basically to services. I mean, that flows down. We're not hiding that money anywhere. We're not segregating that money out or anything like that. That went to the bottom line for services. That's a fair statement?
That's correct. During the audit process, they would have looked at the invoices paid and the services delivered, and then say, "Yep, these appear to be
right
actual expenses."
The reason I'm saying this is because we've taken some criticism, okay, for certain groups, but we put up the money, and that to me, you either put up or shut up, and we put up the money, and we've done this for 3-4 years running since COVID, but the truth is we can't do it anymore. And that's why we've taken measures such as the fee for services and other things that will put us in a better financial position. So I don't want to hear, I'm going to be honest with you, I'm going to be hard pressed to believe anybody if they complain that they're not getting paid or they're not getting paid what they think they should get. We put out a lot of money last year, and I'll be glad to hand them the audit and give it to them. And we all should. So when that criticism comes forth, you can tell them we went over and above, and that money basically ends up going to providers because they're the ones providing the services. You know, we don't provide that many direct services, right? Some, but the lion's share of services are provided. So I feel positive about this report because we're 2/3 through the year. Knock on wood. Hopefully, it might bring a day to break even, and then we're going to have a big party, for everybody. So that'll be good. But again, I appreciate the work you, others in finance have done, and our staff as a whole, in helping us get this much improved results over last year. That's very significant change. Thank you.
A question I have, Mr. Chair, on the eligibles, and as I look at the chart, and mention.
Can we go back to that slide so everybody can see it? Go ahead, Pastor Jones.
Eligibles.
Third.
The right one. Two more. I probably should have asked when it was up.
It's okay.
I was sleeping through the other slides. There we go.
All right.
Thank you. Thank you. And you mentioned part of because of the eligibles, I'm very concerned in relation to the impact. I know it's unknown. Of Medicare, Medicaid, and the chart indicates going to September, you do expect loss of eligibility, if I'm reading this correctly. And my question is do you have the ability to project out maybe how much or what? Because it certainly gets back to the services, which is our chairman has talked about, what we're trying to provide for them. because even in a bad time, we've given service. And so my concern is what that deficit looks like, or maybe projected even at the end of the year, dollar-wise or something, as to how it will impact us. And then what that does also, because you have it referenced in the chart, is the cost of our administration. Okay, because the administration cost has gone up, over a period of time as well, which impacts, personnel. So I don't know if I'm asking the right question. I think I'm looking futuristic, not having what's going to happen with Medicare, Medicaid, but the impact already shows some negative impact on us.
Yep. So, so I do anticipate that unless the department figures out some of the root cause and maybe some of the procedural changes that may be necessary to keep people from falling into the plan first or to other or off of the eligibilities, that we will continue to see the kind of a steady decline maybe throughout the end of the fiscal year. If I understand the question, the concern is then, does that make our potential negative position worse by the end of September? And what I will say is it may. I have two different opposing issues that we're going to have to figure out. So yes, eligibles will continue to decrease. I believe they will continue to decrease, although slightly, and that's going to be negative to our revenue position. But this revenue adjustment that the state's making in July and August will be a positive to our revenue position. I believe, having not seen the formula that the department has shared with us, that the positive impact of the revenue, the rate adjustment will outweigh any negative eligibility we will see between now and the end of the fiscal year. So I expect that we will continue to improve our financial position between now and September. So I think we might actually end better than we are currently projecting. But again, all of that is subject to, it will be much more known in the next 4 to 6 weeks.
With what they're giving.
Correct.
Questions from policy committee? Okay.
Just one brief
Nope.
comment,
Chris.
John, sorry. I do want to give some kudos to disability advocates who finally got the state to address the problem of individuals who get on what Michigan calls DAC status, Disabled Adult Child Benefits, where their SSI, when they transition from SSI to SSDI when their parents take Social Security. We had seen huge issues with the state not processing those individuals over to DAC status, and it involves an email address and really archaic things that they do to process those applications. Thanks to Disability Rights of Michigan, the ARC, and those organizations, they finally have gotten them to proactively look at that status. And when I last got information on it, they did a review of that, and they found 965 cases statewide in just a short period of time, which I translate as probably close to 100 in Oakland County of people that should have been on DAC status that were not transitioned to DAC status. And DAC status is full Medicaid. And those people were getting ignored. So hopefully that is one of the eligibility pieces that we will start seeing some better results. And it's very important that if we find people that fell through that crack during redeterminations, that we get them to the right people to get that evaluated, because that was a real problem. And that's real Medicaid dollars that we were losing out on.
Yeah, it is a great point. It's not only is it real Medicaid dollars that we're losing out on, especially if someone happens to be in if they've aged out, they're on DAC status and they have gone into the HAB Supports waiver program, because that's actual HAB Support waiver payments that we don't get as an organization. But then it's almost a double whammy, because then if we do continue to provide services, which I think we've done a good job in doing, it ends up hitting our general fund contract. And as we know, we don't have sufficient general fund dollars either. So we lose the Medicaid dollars and we end up overspending on the general fund, again, leading to some of the financial issues that we've identified. But it is a great point, yes. Hopefully we can see some of that proactively being addressed.
Okay, good question. All right, so no other questions. Sheila, do we need to do anything? It just goes to receive and file. All right, okay. All right, we'll move to item C. We had the auditor's bid process, and you're going to present the results of that.
Yes, although when I try to, I don't know, Sheila, am I doing something wrong? 'Cause
Oh, it's up now.
okay, there we go. Very good. Yes, so we did go through the RFP process for a audit firm. We do that periodically to ensure that both, again, we're getting a good price and we're getting a well-qualified audit firm. We are recommending that BDO USA PC, which Jason Kelly is from BDO, that we would extend or we would enter into a new contract for 3 years, so the 25 fiscal year, 26 fiscal year, and 27 fiscal year for a proposed amount of $227,500.
Questions from Finance Committee? Questions from the Policy Committee? Okay, so I need a motion to take
So
this
moved.
to the full board.
Oh, I'll move
Yeah,
to take it to the board.
Yes,
Support?
support, okay, there we go. It's a really quiet afternoon. All right, Sheila, need a roll call vote.
Mr. Furman? Yes. Pastor Jones?
Yes.
Dr. Guadalupe? Yes. Mr. Young?
Yes,
Motion carries.
thank you. Thanks, Richard.
Thank you very much.
Thank you.
All right, I will turn over to the Policy Management Chair. Yvette, what are you going to cover the next items?
Ms. Warner?
Good afternoon. It's my pleasure to bring you our upcoming proclamations for September. We can go ahead and go to the next slide, please. The first one, well, actually, I'll just kind of cover both. So this is our ongoing effort. Each year we reach out, we kind of call on our cities, villages, and townships, as well as our school boards and our faith-based organizations to support our proclamations for both National Recovery Month and Suicide Prevention Month in September. So we're once again doing that this year. So I bring to you our revised for 2025, our National Recovery Month proclamation, as well as the next slide is our Suicide Prevention Month proclamation. And I'll go ahead and review each of them separately for any questions or comments. And I will note that on that first bullet there, I see a little transpose of SAMHSA, but we'll adjust that. But I just wanted you to make aware of that. So first of all, National Recovery Month for September 2025, whereas according to, spell it out, the Substance Abuse and Mental Health Services Administration, for SAMHSA, 2023's National Survey on Drug Use and Health indicates that 17.1% of Americans and about 48.5 million people had a substance use disorder, yet fewer than 15.6% received treatment. And whereas federal data shows overdose deaths have dropped from 110,037 in 2023 to 80,391 in 2024, this is the lowest since 2019. And whereas Michigan reported a 34% reduction in overdose fatalities, so approximately 2,931 in 2023 to 1,927 in 2024, marking the third consecutive year of decline. And whereas over 1.3 million naloxone kits have been distributed statewide, reversing nearly 34,000 overdoses, and whereas OCHN continues to educate and raise awareness of the risks and potential harm associated with prescription drug misuse, and whereas substance use disorder recovery is a journey of healing and transformation, enabling people to live in a community of their choice while striving to achieve their full potential. And whereas substance use recovery benefits individuals with substance use disorders by focusing on their abilities to live, work, learn, and fully participate and contribute to society and enriches the community culture. And now therefore be it resolved that Oakland Community Health Network hereby recognizes September 2025 as National Recovery Month. OCHN calls upon individuals, government agencies, public and private institutions, businesses, faith-based organizations, and schools to recommit to increase awareness and understanding of substance use and the need for appropriate and accessible services to promote recovery. And that is it for the Recovery Month proclamation. We will, as mentioned, I'll go over the suicide prevention one in just a moment. As mentioned, we'll be mailing these out together to our cities, villages, and townships, as well as our school boards and faith-based organization, asking them to join the movement to support these and accept them and approve them at their school boards or CBT boards, as well as any meetings that faith-based organizations may be having. Do I have any questions or comments about the recovery celebration or Recovery Month?
Policy Committee, do you have any questions? Ms. Root?
I just wanted to ask, when I read it and then when I heard you reading, you added some connector words. Are you going to type those in there? Let me point out an example. Mission. Well, now I don't know where I was looking, but you added in some words as you read, like indicating. I don't know. I could send an email. I don't want to waste time. But yeah, there were just a few moments in there where it sounded kind of awkward and you added like connector words.
My apologies. If
No,
you would
that's
like to
fine.
send me those
Yeah.
connector words, I am happy to make those adjustments in the
Sure.
proclamation so that we can make sure the board has those changes.
Sounds good. Thank you.
Okay, thank you.
Any other questions, Policy?
All right, I will carry on with the Suicide Prevention Month proclamation, and if I do have
Did
any...
you want me to do the votes separate?
Yeah.
Because they're listed separate.
Yep.
Okay. So, Ms. Barrett, if we could have a roll call.
Dr. Hans?
I was not present for the full presentation, so I will recuse myself.
Ms. Newman? Yes. Mr. Smith? Ms. Woodruff?
Yes.
And Ms. Root, sorry. You have a- Okay.
All right.
Motion carries.
So the motion carries. That will move to the full board for approval. And if you want to start with the next proclamation.
I would be happy to. As mentioned, September is also National Suicide Prevention Month, so we also include our Suicide Prevention Proclamation, and I'll go ahead and review that now. National Suicide Prevention Month, September 25. Whereas September is known as National Suicide Prevention Month and is intended to help raise awareness surrounding suicide prevention resources available in the community. And whereas World Suicide Prevention Day is observed each year on September 10, and whereas suicidal thoughts can affect anyone regardless of age, gender, race, orientation, income level, religion, or background. And whereas according to the Centers for Disease Control and Prevention, CDC, more than 49,000 people died by suicide in 2023. And whereas is one of the leading causes of death in the United States. And whereas organizations like the National Alliance on Mental Illness, or NAMI, and the National Suicide Prevention Line, 988, work to help individuals in crisis and provide resources to shed light on this highly stigmatized topic. And whereas every member of our community should understand that throughout life's struggles, we all need the occasional reminder that we are all silently fighting our own battles. And whereas Oakland Community Health Network, OCHN, is committed to being a zero suicide organization and cultivate a network of providers who are engaged in the zero suicide philosophy. Now therefore be it resolved that Oakland Community Health Network hereby recognizes September 2025 as National Suicide Prevention Month. OCHN calls upon our individuals, government agencies, public and private institutions, businesses, faith-based organizations, and schools to recommit our state to increasing awareness and understanding of suicide prevention and the need for appropriate and accessible services to assist individuals in crisis.
Okay, you've heard the Prevention Month proclamation. Policy members, do you have any questions? Go ahead, Ms. Newman.
Graph, it says silently fighting. Some people are not silently fighting. So I think we should take that out and just we are all fighting our own battles. Because some people let you know they're in a battle.
Absolutely. Happy to make that correction.
Okay. Any other comments or questions? Go ahead, Mr. Cowan.
Thank you. Suzanne, there was in the first resolution on the National Recovery Month, there was some very specific information about Michigan, which quite frankly was extremely impressive, a 34% drop in overdose fatalities from 23 to 24. That's phenomenal. And I would note that I think it's safe to say that with the distribution of the kits, that saved a number of lives and the availability of that. In the suicide prevention, there didn't seem to be the specifics, and I don't know, I know we're looking probably at two different databases. Is that information that's Michigan-specific available?
I am happy to research that information,
yeah.
and we can provide that to the board for a review
Right.
prior to the board meeting.
Right. I mean, whether it's, every suicide death is negative, but if there was any improvement or not in statewide, I think that would be helpful if you could get that information to us for the board meeting.
I'm happy to do that.
If it's makes sense to change the resolution, I'll leave that up to your judgment. But thank you.
Of course.
Appreciate that.
Yeah.
Thank you, Mr. Cowan. Pastor Jones?
Thank you. Question I have on both of these, and September is just a great month for us to recognize this and get this out. In relation to both of these, the drug addiction, the suicide, in the faith community, we have a high incidence of drug overdose or drug abuse and suicides among clergy. And it's almost it's a silent thing. And I'm just wondering, I don't know what our outreach is to know the different churches that send something there and say, guess what? September's month, we're really focusing on this, that it gets into the hands of the churches, of the pastors. Yesterday, we had a person from here, from the crisis team. Her name is Parrish Leisure. And I tell you what, her presentation to our congregation was nothing short of exceptional, to the point that today we were fielding calls of how do I reach them, what do I do, this is what I'm going through. And so I know if it's hitting our congregation, it's hitting others. And so I don't know how you get this out. I don't know if our staff here, many of them, 13,456 people who work with us, would take this letter to their churches and say, just want you to know, because it is so, it's prevalent. It's prevalent. And it's on my heart, and I know it's on the hearts of many pastors. How do we do this? How do we do this? So, it says that we're reaching out to the faith community and what have you, but I think we'd like to see how we do it. I'll take some of this as well, but I just think that there has to be a better way to distribute this, because it does not matter what the denomination is. It's hitting all of us. It's hitting all of us. So, however you're distributing this, I'm happy about what we're doing here, but my question is, how can we further distribute it to areas where people are trying to ignore it? That's the thing.
Thank you for that, Pastor Jones. Paris is pretty exceptional. I'm glad you enjoyed her presentation. We would welcome any assistance you can provide with some of the pastor organizations that you're involved in, and we'll bring this information with us. You'll see it, my community update, we're at some local churches, so we're happy to bring this information to those places if we can get this message out in any way possible, even at the grassroots level. That way, we would welcome that. So any assistance that anyone can provide, we welcome that.
And since you're giving me that challenge, this week, I'm meeting with a group of pastors, and the next week, we meet with pastors throughout Michigan, the Wolverine State Convention, and on that Monday, we're going to talk about mental health. And so if you give me some copies, and I'll take them with me.
Wonderful.
Okay?
Thank you.
And I'll take them with me during the course of this week, because it is a big issue. And I am surprised, I'm not surprised at the number of parishioners, and with what's going on economically, it is heightened. It is heightened. And so, however, we can let them know that service is available.
Wonderful. Appreciate your passion. Thank you.
And perhaps using some of the religious newsletters. Any other questions? Thank you. Ms. Barrett, may we have a vote?
Mhm. Dr. Hans?
Yes.
Ms. Newman? Yes. Ms. Root?
Yes, but I think we missed making a motion for both of these.
I guess I should have asked the question. To make a recommendation to move to the full board, do we have support for that?
So moved. Mr. Smith? And Ms. Woodruff?
Yes.
Motion carries.
Thank you.
Okay. Ms. Suter.
Good evening, Vicki Suter, Director of Rights and Advocacy. I'm bringing to you a recommendation from the Recipient Rights Advisory Committee to appoint Ms. Renee Judkins to the Appeals Committee. Our requirements are that 3 individuals from the RAC Committee are part of the Appeals Committee. We had a previous RAC member who termed out, and she was also on the Appeals Committee, so we had a vacancy. And the RAC Committee is recommending that you approve Ms. Judkins to fill that position.
Thank you. Any questions before? Okay. Is there a motion for a recommendation to move this to the full board for approval?
Support.
Ms., any additional questions before we go for the vote? Ms. Barrett, if you'll do the roll call.
Dr. Hans?
Yes.
Ms. Newman? Yes. Ms. Root?
Yes.
Mr. Smith? Ms. Woodruff?
Yes.
Motion carries.
Thank you.
Thank you.
And John, I believe it's back to you for the other business.
All right, thank you. Item 4, other business. First is CEO evaluation reminder. Is Nicole here?
This is just a reminder. You guys, everyone should have received an email from Ms. Williams starting last week, and this is actually the second time she distributed it. It'll be open until Thursday. Correct me if I'm wrong. And
So fill out your forms.
Thank you.
Which she needs to compile the data for next week's approval. So that's going to come from a recommendation from the committee. So it's just a reminder.
So if we end early tonight, then you can stay after and fill out your forms. Okay. All right. I know she's scrambling. All right, Suzanne, you're back up for 4B, events outreach.
And before Suzanne gets to the events and outreach, I don't know, Dana, you want to bring up the Tri-County event for the 24th?
I spoke with Tracy Smith, who's the CEO for Macomb Community Mental Health, and we're still waiting to hear back from Detroit Wayne on whether or not they confirm for the 24th. So as soon as we find out, there was also a request to have a hybrid meeting, and I offered up our location if we were going to do hybrid because it's sort of in the middle for both. So just waiting to hear back confirmation from Detroit Wayne. And if not, they're thinking of pushing it to August 24th instead, which, you know, is down the summer holidays and vacation, so it may be a little challenging. So we're hoping to hear back from them tomorrow.
So would that bump our study session for August?
So usually it's in lieu of study session, but this month the study session's canceled.
I know for
so,
July, but I'm just thinking with what we heard from Richard,
right?
We may need study session, depending on what the state does.
So we can look at the calendar once we hear back from DeWin and Macomb to see if maybe we recommend if it's going to August that it doesn't take place the same week of our study session.
Yeah, I just think we're going to need that study
Yeah,
session.
and just a reminder, this would be the 24th, so next week. So in lieu of our study session, it would be this month ideally, but it will be in a hybrid format, so you guys could attend it virtually.
Okay, all right, thank you both. All right, Suzanne.
Hello again. Just want to highlight a few of our community outreach efforts. As noted on the slide, we hosted our annual Minority Mental Health Awareness Month event last week. It was very successful. Thank you so much, Malkaya, for helping to coordinate it as well as attending. We had well over 60 individuals that attended, numerous vendor tables as well, and a really rich discussion. I mean, it was just phenomenal. Our students, I'm just so impressed with the youth that we have coming forward. It's just, they're amazing. They have such insight, and they're wise beyond their years. So our youth panel was phenomenal, as well as our speakers who talked about some cognitive wellness, which is something we all can think about, as well as resilience across generations. So it was very interesting, and we're hoping to bring some of these speakers back because they were just phenomenal. I've got some photos to share with you at the end. I just wanted to really highlight that event because it was really an inspirational event. So also wanted to mention a couple of festivals. We participated in both the Middle Eastern American TV Festival as well as ViewFest, the Mental Health Walk and Celebration, which was huge. There are over 4,000 people there. Dana and Tricia were there as well, and we hosted a table that's held at the Detroit Zoo. I think that event gets bigger and bigger every year, so it's a really important event for us to be part of. So we were glad to be there, and Dana was able to say a few words. Also wanted to mention we've got some trainings that are coming up, as well as some community events that we're participating in, as you can see on the list, which includes Family Market Days. So we're excited to participate in those each year. Next slide, please. And also just some things that are coming up for August, but as well as continuing through July, is we have some additional trainings. We have we're participating in this community forum, The Dangers of Synthetic Drugs. It's coming up later this month, as well as some additional trainings coming up. And then we're also, as we did last year, participating in the Brooklands Block Party in Rochester Hills. So it's important for us to stay connected with that community as well. Next month we have coming up, we're participating in Oakland County's Health and Housing Fest, and then we're hosting our Your Voice, Your Value, our annual Your Voice, Your Value event, where we honor individuals for their achievements as well as our peers for their achievements. So we hope you can join us for that event. And that's going to be on August the 5th. Next slide, just highlighting some of our press releases. We already sent out our Minority Mental Health Awareness Month press release. We'll be releasing one related to American Disabilities Act and kind of combining it with Disability Pride Month. Then some of our ongoing outreaches far as advertising, as you can see, we do a number of different things ongoing to get the message out there about OCHN. One thing I also wanted to note is we do also do some social media. We sort of boost some different messages and kind of keep up on that with our social posts. And then our conference usage. And then the one I really wanted to share with you is some photos from our minority mental health event. We do host an ambassador program. Amelia was our ambassador for this event, and she's at the table with one of our staff, as well as a picture of our youth panel that I mentioned, that they were phenomenal, and one of our speakers, as well as individuals that were attending. So that's all I have. Thank you.
Item 5, our second opportunity for public comment. Anyone online?
If you are online and wish to speak for public comment, please raise your hand at this time.
Anyone in the room? None. All right, we'll shift to board member comments. Let's start with Adam.
Thank you. I'd just like to thank the auditors and Richard for his presentation tonight. It was very positive, and keep up the good work. Also, the proclamations that Suzanne read tonight, I know a lot of work went into those as well. Thank you, as well as the events that we have our presence shown at every month. That's very important in terms of visibility with what the organization does. So thank you for that as well as the hours that are used to put together the agenda packets and general agenda for each of these meetings. Thank you very much, and have a good evening.
Dr. Giles hiding over there. I saw you come in. All right, Chris.
Yeah, just real quick, I want to say these outreach and awareness updates are becoming the highlight of my service, something unexpected. So thank you so much for it. It just makes me want to retire so I can actually attend, because I really want to be there. But it's really neat to see. Thank you.
Sarah.
No comment.
Yvette.
Just wanted to piggyback on some of Mr. Cowan's comments about National Recovery Month on drug use. I was really surprised at the reduction for the state of Michigan. And yes, I agree that given the naltrexone kits probably has made the biggest difference. And also, I attended the VAPE 101 session virtually this past week. I was a little disappointed in the amount of people that participated in the training, and it could be because it's offered periodically, and I would recommend that some of us take advantage of those trainings. I try to do at least a training a month.
Thank you. Very good. Thank you. Okay.
I just wanted to echo what Suzanne said about the Minority Mental Health event. It was a very well attended and a very good event, good speakers. Sometimes it's hard to set that time aside when you have a full-time job. But I thank God that I have a lot of flexibility, even though I'm full-time, and I am able to participate in those types of events. But it was really good. And I'm proud to be associated with an organization that does good quality events. Thank you.
Good. Thank you. Dennis?
Yeah, again, I just wanted to thank everyone who's participated in this process to work through the finances of the organization. And I know that the work that was unseen by many of all of our staff, and I think is very important and should be noted, and thank you. I know it moved a lot of people out of their comfort zones because we're used to doing things a certain way, and then you're asked to do it a different way and also to communicate it effectively to some providers who don't want to change either. So we understand that, but please know we have your back. We appreciate it. And, you know, it dawned on me that after really a very significant improvement in financial performance between last year and this year, you know, no good deed goes unpunished. So now we have threats from the state in terms of this process that they want to put in place. We have a bill at the federal level that it's still uncertain how it will actually impact us, and I'm looking forward to seeing some information. But as I've said very often, if you wanted applause, you should have joined the circus. So we will have to just note among ourselves and to those that we serve that we are doing everything we can to make sure our finances are in good order, as was reflected tonight in the audit, and to continue to serve, even though it's not done with a lot of applause. So, thank you.
Pastor Jones.
Thank you, Mr. Chairman and Acting Chairman. 3 things. One, I too was excited about the audit and just the success that we're having within that, or the good news from that I want to point out. I heard once a person said, accept the accolades and the praise when you get it, because I'm going to cuss you out when it's wrong. And I want to say to our chair that she has done, our CEO has done an excellent job. And so when things were hairy, she received the abuse. But today the things are looking better, so I want to give you the accolades, because when it goes the other way, I'll give you the abuse. So that the other thing, and it is so. Thank you, Suzanne, for what work that you do, and I'm just really excited about what Ms. Parrish did yesterday for my congregation. But this mental health and this drug abuse is really a big issue. And it crosses all lines, it crosses all ethnic groups and what have you. And we really have to reach out, because there's a lot of people who are silent about it. A lot of people. And they're right next door to us. Right next to it. At the next desk. At the next desk. And so maybe it's awareness, maybe it's reach out or something, but let us recognize what we're going through. And these services, these announcements, don't treat them just like a piece of paper announcing it, but ask, what can I do? What can I do? So I say that to you because it's such a big issue among pastors, ministers, clergy, of all sorts, and the people that we work with. So thank you for the reports today. I thank the staff for everything that you guys do and the extra work that you put in. And I tell you what, I don't know what we'd do without you. So thank you.
Christina?
Not going to try and follow that up, so I'll say ditto. Thank you. Have a good night.
All right. Dr. Hans?
No comment, thank you.
All right, and I will pass, so we stand adjourned. Thanks. See everybody next week.